We're not making salad dressing today with this olive oil.
No, we are not.
This is pure organic ozonated oil, and Dr. Ron Dummar, it's more than meets the eye.
Oh yeah, this will help you with anti-aging. It'll help you with oral hygiene and care. It'll also help with healing wounds. If you don't have your health, what do you have?
You are a functional medicine doctor.
Join us as we blend modern and ancient wisdoms to be well now.
Welcome to Be Well Now. I'm Nick, the Curious Patient.
And I'm Ron Dummar, Dr. Dummar, community health and wellness, and I'm a chiropractic physician and a natural health physician, so I do Chinese medicine here.
Heber City, Utah.
Heber City, Utah.
Look, we've done dozens of podcasts, and I would say about a year ago, you kind of showed me this stuff you were putting on your hands, and I was like, still am, drinking some coffee to get through, and you put some olive oil on your hands and kind of like sniffed it, and you're like, all right, I'm good to go. And I'm like, what is this magic elixir, this ozonated olive oil that I see all around your clinic? I'm going to try some right now.
Super interesting. During COVID, hand sanitizer has always been kind of a big thing, hand sanitizer. It's also shown to be somewhat problematic. So hand sanitizers can be really harsh on the skin, the environment for the biotics of the skin. You actually need a biotic culture and balance in the skin to have properly moisturized and healthy skin. And the hand sanitizers can be really hard on that. And so during COVID, we were trying a variety of different hand sanitizers because it was necessary for everybody and to help everyone feel comfortable as well during that time, and to improve hygiene and cleanliness. So what we wanted to do is find which type of hand sanitizer or which mode or method we felt like would be most effective and have the least impact negatively to the skin health. And what we came to through our research and our trial and testing was ozonated olive oil. And
what does ozonated mean?
So essentially the ozone is 3 oxygen molecules bound together, and we pass that ozone. It's a gas. It's actually a layer in the atmosphere. And we pass that ozone gas through an oil, like olive oil. And as it bubbles in through that olive oil, it will bind. So an oxygen molecule there with the ozone will bind to a carbon molecule, and we're left with what we call ozonides. Now, ozone itself is actually it's very pervasive in the sense that it will break down certain bacterial cell wall, and it will unravel viruses.
So that's why this is good for antibacterial.
Right. It's antibacterial. It's anti-infective. It's antiviral. So
you run the olive oil through this ozone machine, and now it's this magic potion, or what?
Yeah, it's just like that. Wing. So we run the olive oil, the ozone through the olive oil. We have to do it for a certain amount of time. We actually do it for almost 48 hours or more. And but then it allows for all of the ozone to permeate into the olive oil. And then we'll mix a variety of different oils in there with it as well, depending on what we're using it for. So sometimes we'll use it more topically for skin. Other times we'll use it for oral care. And depending on which area we're using it, we'll implement some of our Chinese medicine as well and mix some of those oils in there that are also really good for that area of the body.
So what about like a natural antibiotic? Because I've used it. My daughter gets like cold sores, or she licks her lips too much. I think it's like maybe something when she's anxious.
Yes.
She gets really chapped lips, but then like right below her lip gets really red.
Yes.
And she'll say, "Daddy, can you put some of that oil on?" And it really helps.
Yeah,
she's 7.
The skin and the topical ones that we have, we usually will put some lavender and some frankincense and some other oils in there that are really beneficial for the skin. And things like the redness and around the face, or even on the hands, the cracking and things on the hands. When we try to overwash the hands or overutilize hand sanitizer, we can get a lot of that cracking because the bacterial balance of the skin is not right. And so it leads to a lot of that roughness, that cracking and blistering even in the hands. And so applying olive oil with ozone has actually been shown to be beneficial and selective to not unravel or not break down the cell wall of all bacteria, but to be a selective antibiotic. And so we've been using ozone in our clinic for quite a while to assist with our antibiotic treatments, our antibiotic therapies for patients. And we've used it a lot in gut-related issues as well. But applying it as an antibiotic topically, so we'll use it for skin disorders like rashes, we'll use it for eczema, we'll use it for candida type rashes as well. But we'll also have to, in those cases, use more internal medicine as well to make sure we're getting the inside and outside. But like you're saying, any sort of lesion around the mouth or the skin, I'll apply this ozonated olive oil to, and it typically will resolve it very quickly for patients.
So I want to talk about hand sanitizer as well. So hand sanitizer, rashes, sunburn, it kind of becomes your all-in-one topical solution before you like freak out. Like, is it a pretty safe, like, I don't know what's going on here, maybe I could try this?
Yeah, absolutely. So minimally invasive is a very classical rule to follow within medicine. And so we like to be as minimally as invasive as possible. And essentially that means, well, let's use the potentially most beneficial and least impactful substance first. You know, if we can avoid surgery, should we? Well, yeah, we should. And so the idea here is to say olive oil and ozone are about as benign of substances as you can imagine, and yet they have powerful impacts and beneficial impact on the body. So if we can give the body nutrients, the vitamins, minerals, the fatty acids that are involved in olive oil, and also deliver ozone, which is an anti-infective, antiviral, and antifungal, and an antiviral, if we can deliver that to the skin and to the area where it seems like we're having this disruption of the dermis, then we're going to be able to have significant change in a very without impeding or interfering with the natural biome of the body.
These are all available at Earth's Medicine Cabinet, so link in the description below.
Yeah, Earth's Medicine Cabinet, exactly where you can go buy them. And there are some for oral care.
Yeah,
we have some for...
ask you about that. They're different formulations, oral versus topical.
Yes, so we have oral care. And oral care, some people that are listening to this and that follow us are probably familiar with the idea of oil pulling. So oil pulling has been used a lot to help with oral care, and also because there's so much vasculature, vessels that are present and close to the surface in the mouth, we're able to pull nutrients or exchange nutrients very quickly in the oral cavity. And so oil pulling is this idea of swishing with an oil in the oral cavity with the intention that doing so is going to draw out toxins, heavy metals, certain bacteria that might be forming or becoming overabundant in the mouth or even in the vasculature right around the teeth and gums.
So would you use that instead of like a mouthwash?
Yes, 100%. So most of your mouthwashes have significant chemical ingredients. They have dyes in them. If you look at the back of that mouthwash, and of course our listeners are very intelligent. They're very smart. And so they're probably already looking at the ingredients of the mouthwash and are selecting more healthy mouthwashes. But typically you'll see in a mouthwash, especially, well, I'm not going to say any brands, but you'll see even flavorings and dyes. And the dyes, the flavorings, and then also you'll see preservatives, sorbate, potassium sorbate, and a variety of different heavy chemicals and things that you just don't need in your body. And again, we've talked previously about plastics and phthalates and all sorts of different chemicals that are disruptors to the endocrine system. Well, doing that mouthwash at night when you have those flavorings and those dyes and those all of those different plastics becomes a problem for you. So if you can use your oral care, you can use that ozonated olive oil instead. It's going to benefit the mouth. It's going to benefit the teeth and gums, and it's going to lend itself to promoting a healthy environment in the mouth. So better breath, less cavities, right? Less pain, less swelling gums, gingivitis, like reducing gingivitis onset. So yeah.
How much would I put in my mouth? How would I even use it?
So typically what you want to do is about a tablespoon, well, teaspoon to a tablespoon. And then you swish with that for 10 minutes. So it's a commitment. You stay committed to it and you swish with it for about 10 minutes.
Oil pulling is the same thing. Like I've tried that before.
Correct.
Yeah.
And typically you'll use coconut oil with oil pulling. But this is
even at the like natural health food store, you find something and there's a list of 40 ingredients in there. And you're just like, some of these have to be to preserve what this is in a bottle, to distribute it to stores and go through weather, changes. And it's like, I like the idea of something in a glass bottle, minimal ingredients. Like,
look at how many ingredients in there.
All right. The oral, let's see how many. Ooh, ozonated olive oil, clove oil, peppermint oil.
There you go.
And it's pure organic ozonated oil. So yeah, I got to try it. People are going to be like, so you just made all this stuff up? Like, why would this actually work? You mentioned anti-aging effects, acne treatment.
Let's talk about some of the anti-aging effects. There's antioxidant.
I'm going to try this on my little pimple here.
Because of the ozone, what the ozone does in the body is it elicits a strong antioxidant effect within the body itself. So the body actually makes antioxidants as well. We consume a lot of them in colorful fruits and vegetables. We get a lot of antioxidants that way. But the body actually makes antioxidant as well. And so it stimulates the production in the body of antioxidant. Okay? And so when you apply it to the skin, when you swish with it in the oral cavity, it is going to stimulate the antioxidant effect, and it will help to reduce inflammatory processes, reduce swellings, reduce inflammation, all of those things it's going to help benefit. From an anti-aging, you mentioned that. From an anti-aging effect, we're talking about reducing the likelihood of the development of wrinkles, okay? Age spots, reducing and minimizing aging spots. You can use it as a moisturizer.
It does, and I've used it before because I've bought many bottles. When you put it on your face, there is a bit of an oily look to it, and even on your hands. If I'll put dollops on it, and your hands will they'll feel a little oily. So you gotta really measure your dosage out. Not measure it actually, but just less is more. Small. I feel like less is definitely more. A small amount, and especially if you're using it for your facial care, if applying it topically. And then allowing yourself to kind of massage it in a little bit, and then leave it. And it does go away. It doesn't stay super oily. It absorbs into the body. Yeah. Mm-hmm. So you mentioned some of the anti-aging properties. What about acne? Yeah, well, acne, it's very beneficial for acne too. Let me just say a few more things about the anti-aging, certain things that people are really concerned about, things like even stretch marks. It can be super beneficial applying it regularly to those scars, those stretch marks. What if a woman is pregnant? Is it safe on their skin? Absolutely. As they can use that topically. Okay. Uh-huh. Yep. That's a really great question. And infected sweat glands. So if you're having an infected sweat gland or you feel a boil or a bubble right there, you can start to apply that. People are using, because ozone is also a deodorizer, people will use it as a deodorant. And so you can use the ozonated olive oil that we have for skin and topical purposes as a deodorant as well. I had a patient just recently who came to me and she's like, oh my gosh, I love that. I need more of that stuff. And I'm like, oh, what are you using it for? And her main purpose was she was using it as a deodorant. And
And I'm like,
Does it work?
Great. Yeah, works great. Now, you may get to a point where you're like, oh, I need to use a different deodorant and maybe use it somewhat 3 or 4 times a week or use it 2 times a week and alternate
because those
back
deodorants
and forth,
are just filled with chemicals.
When you look at those deodorants,
at the ingredients,
yep, there's a whole large list of those, and you try to get as minimally invasive as far as the plastics and the chemical ingredients in there as possible. And if you can have ozonated olive oil function for you, again, that's minimally invasive.
I've tried the natural ones and it feels like they don't work. And then you see the people online saying it's all a function of what you're putting into your body, how you smell. And it's like, okay, I get it. But it's like at some point in the modern world, I just don't know when to stop trying to do everything perfectly.
Right.
And having bought a couple natural deodorants or tried to go without it, it's like, I don't want to smell like this. So it's a tough thing.
Well, as you know, I'm not really obsessed with the perfect play, right, Nick? I'm more obsessed with the longevity play. So what we're looking for is, how do I have something that's sustainable for my current life and something that is functional for where I am? And with this, that's what I love about the ozonated olive oil, because you can use it as deodorant, you can use it as a facial cream, you can use it as a wound healer, you can use it as an acne treatment, as a hand sanitizer. You can use it in so many different ways in your routines. But again, you're not going to doesn't mean you have to completely replace other things that you're doing. You might just say, okay, I'm going to use this and use the other less.
Yeah, like we did a whole thing about how to moisturize naturally, and you mentioned this. And so I tried doing ozonated olive oil just as my hand sanitizer or just as my moisturizer. Then you realize it's sort of a function of like, how much am I washing my hands?
Yes.
Hot water and aggressive soap, and how many times am I doing the dishes without gloves and all these things. And you realize that has a huge role. Plus all the other things you said were like moisturizing naturally from within and all. I know that it has a lot to do with what you're consuming. But anyway, the long story short is that I use this, but I don't rely on it completely. And it's a nice thing. Yes. I have it on my bathroom counter, and I'll just like put some on, you know.
And it smells good.
It smells nice. Like I'll use it periodically as I desire, and I love having it around.
Yeah.
Yeah.
Well, you know, and again with the acne, the acne treatment is really focused on the ability of the olive oil, the ozonated olive oil, to rev up the antioxidant and the anti-infective properties, right? So it allows the body to release toxins, to release chemicals, to open the pores, right? It gets deep down into the skin. It permeates through the skin, and it functions like an antibiotic. Okay, and it's not functioning in a way to overly dry out the skin. Obviously, it's olive oil. And it's not functioning in a way to make the skin way too oily either, which is super fascinating. As I've used it, and I use it almost every morning, I'll apply it to my face. But I put in the blend for the topical. Again, I put frankincense and lavender. But also there's been a lot of research around lime recently, and specifically lime as a useful oil in the treatment of acne pustules. And so we have lime oil in there, and the effect of the lime goes in and helps to the oxidation and the antioxidant impact helps to essentially break down and initiate an anti-infective process that resolves the acne pustules.
I'm wondering, athlete's foot. I don't know much about it. I don't know if that's a big problem in the world, but
right.
There's a protocol for athlete's foot here. And again, I'm just thinking, like, if you have kids, whether it's sunburn or a wound or a rash, and you're just looking for something that is minimally invasive, that's what I love about this, is having it around as like my first thing of like, I'm not a doctor. I don't know what to do. But this stuff is pretty cool, and I believe in Dr. Dummar, and I'm like, let's try this first, right?
Mm-hmm.
And sometimes it works great. It's never like a bad thing.
Yeah.
You know?
So one of the ways I found out that this was beneficial for a sunburn was through my patients. So I didn't ever think to. I usually go for aloe. I go for a really cooling substance to treat a sunburn. So it wouldn't necessarily have been, I'm going to use this ozonated olive oil. It wasn't necessarily my first go-to to say I'm going to apply olive oil to a burn, right? I just wouldn't have done that. A patient, and patients, multiple of them, but one in particular came in and she was like, oh my gosh, and it was the middle of the summer and they had been to a variety of different places and pools and all sorts of things. And they're like, we're using this as a sunburn treatment. And she's like, literally, it's gone. It zaps it, right? So it's like, because it's moisturizing the skin, they get less peeling, the skin not dying and flaking off as much. They maintain the integrity of the skin. And she's saying as well that the pain of the sunburn is reduced in a significant way. And so we started using it in that way and recommending it that way also. So it's very, very effective for sunburns. And again, I think that is because of the ability of the ozone and the olive oil to initiate antioxidant impact, anti-inflammatory impact, and essentially pain-relieving impact within the body because of those.
Athlete's foot, is it the last one?
Yeah, so athlete's foot, you go, wait a minute, what's up with athlete's foot, right? You get that sweaty, sometimes your feet are in your shoes for way too long and it's just they're wet and they're icky and they stink, right? And it's like, what do we do with this? And then they get a fungus. They get this itchy, usually between your toes is where it will start. And it can wreak havoc for people. So one of the best things that I've found is you get a bowl, and for about 10 minutes you get some salt, and you use some Epsom salt, and you put it in a bowl with nice warm water, and you soak your feet. Soak your feet for about 10 minutes in that Epsom salt. So what we're trying to do is really soften the layer of the skin up. And we're trying to really open the pores with the heat and allow it to receive that olive oil so we can get it right into where that fungus is harboring under the skin. And then what you do is after that you dry off the foot, pull it out, dry it off, and then you apply very liberally the olive oil, the ozonated olive oil, in between the toes, over the nails, in and around the arch of the foot, all over the foot. And you do that, if you do that each day, you will be able to have a significant amount of relief, I would say, within a week of doing that, of athlete's foot.
I guess what's the risk in trying? Why not give ozonated olive oil a shot?
You have good smelling feet. That's your risk.
No, I just mean in general. It's like
it's true. It's a good point.
Yeah, it's just a nice product to have around. It's so versatile, minimally invasive, and if you're concerned about all the chemicals you see in anything you buy, even in the natural health food stores, having just a few in a glass bottle from someone you trust, I think makes a lot of sense.
Absolutely.
Another fantastic episode of the Be Well Now podcast where we focus on healthy living year round, living in the present, and lots of olive oil on the skin.
Yeah, and make sure, again, I mean, for your hand sanitizer, for your sunburns, for, athlete's foot, anti-aging, there's so many different uses of this. I think it's really something that everyone should have in their medicine cabinet or, like you said, out on your counter.
Eczema. Psoriasis.
Eczema, psoriasis. There was a research article that we didn't mention. I'll mention it right now. Recent study, I wrote this down. Recent study published in the International Wound Journal summarizes that ozonated oil can promote healing of skin wounds and topically treat atopic dermatitis, psoriasis, superficial bacterial infections, and fungal infections.
What about a quick sniff on my hands after I put it on? Is that?
Yeah, I love that. That's what I do. I love the way it smells. Yeah.
Wonderful. Everybody, it's been real.
Be well now.
Namaste.
Namaste.